All right, welcome to our rally for mental health care. Everybody come on up. I want all my fellow nurses and allies around me. Check out this powerful gathering. We want to show our support for mental health. My name is Mara McDonald, and I am a nurse on the Adult, Child, and Adolescent Bipolar Services at Western Psychiatric. Adult psychiatric care is my passion. In my career, I've seen young patients' lives transformed when nurses have adequate resources to provide care. I've seen firsthand how quality mental health treatment can positively change patients' futures as well as their families, communities, and the world. Because when young people get the support they need, they find careers, lasting relationships, stability, and purpose. But the amount of patients I have to care for in my current position at Western Psychiatric makes it very difficult to provide the therapeutic interventions that my young patients urgently need. In my previous job in adolescent psych at a non-UPMC facility, I usually had around 6 patients per shift. That allowed me to speak with my patients when they were in crisis, to help them practice the coping skills they were learning during their admission, and to express understanding and empathy, which is something that is desperately needed. Here at Western Psych, I have more than double that workload. I usually have 15 patients. It's not much time to do anything other than the bare bones of charting and passing my medications. UPMC frequently mixes patients with different diagnoses on specialty floors, making it difficult to provide the specific care that our patients need. Now UPMC has announced plans to reduce the number of beds on our unit. I want to do so much more for my patients, but my working conditions won't allow me to. Understaffing leads to burnout and exhaustion. Undercompensation adds insult to injury, and I mean literal injury. Because of short staffing and mixed patient populations, we're often in dangerous situations and sometimes sustain injuries as staff. The topic of mass quitting does come up quite frequently at Western Psychiatric because UPMC just does not respect us. But we're not going to quit. We're working through our union and together as nurses to find solutions, to find a common ground. We want to stay here because we love our patients. Isn't that right? Thank you. In our union contract negotiations, we have made common sense proposals to improve patient care, including higher wages to attract new nurses and retain our experienced nurses. UPMC has rejected these solutions and offered raises below the cost of living. Our adolescent patients here at Western Psych are at a very vulnerable time in their lives. They often do not have adults in their lives to nurture and care for them. We nurses are left to fill that role. Our adolescent patients here, when I'm unable to provide that empathetic support, and then see that UPMC has leased a $50 million luxury jet, it makes me sad. It hurts my heart. But it doesn't surprise me. It shows where UPMC's priorities are. Their priorities are to provide overseas medical procedures for the ultra wealthy and to condos in Boca Raton. Psych nurses are not their concern. Psych patients are not their concern. We are here today to make it their concern, right? You don't have to look far to find people in the streets asking for help. There are so many lights extinguished due to suicide, depression, substance abuse, and homelessness. There's an epidemic of mental illness in our country, and in our county, and in our city. UPMC must invest in making Western Psych fully operational and fully staffed so we can address this epidemic. Now I'd like to introduce our next speaker. Please give a loud and warm welcome to State Representative Jessica Benham, who is a member of both the Autism and Intellectual Disabilities Caucus and Mental Health Caucus.
I always have to adjust the mic so I'm a little shorter. Are there some nurses in the house? Are there some people who care about patients in the house? As someone who has mental health disabilities, I am always incredibly grateful for the work of healthcare professionals who work so hard to take care of patients and make sure that they receive quality care. But here, they're often doing that in circumstances that aren't good working conditions. And we know that your working conditions as nurses and healthcare professionals, those are your patients' conditions to recover. And so we need to make sure that you have what you need in the workplace in order for your patients to have the best outcomes. And that means that we need UPMC to step up to recruit and retain more nurses and ensure that this workforce has what they need. It is unacceptable that the people who are caring for vulnerable patients in our county don't have what they need, don't have a life-sustaining wage, don't have the benefits that they need, and don't have the working conditions that they need to be able to work in an environment that is as stress-free as possible, that lets them focus on the needs of their patients. And so we're out here today as healthcare professionals, as elected officials, as people who care about healthcare in our county, calling on UPMC to do better. It is unacceptable as an organization that claims to care about the lives of patients that they are not investing in patients, in the workforce, and frankly, in our communities. So we're calling on UPMC to do better, and I want to again say thank you to all of the healthcare professionals who are here for what you do each and every day in what is often not good conditions. Thank you for that.
Thank you, Representative Benham. Now I'd like to introduce Dr. Ken Thompson, a leading psychiatrist both locally and nationally. Is he with us? All right. We will then welcome my coworker, Chris Hunter.
Hello. It's so incredible to see all this unity and support for mental health care. When I say more scrubs, you say less suits. More scrubs! More scrubs! As Maura said, my name is Christopher Hunter, and I have been a nurse at Western Psych for 8 years. I'm also the president of our local chapter here at the hospital. Can we get a loud round of applause for our hard-working bargaining committee that's been at the table with UPMC for over 2 months? A decade ago, I was pursuing a PhD in religious studies because I wanted to better understand how we can create a more compassionate world. In that time, I came to realize that I needed a new path to make a more direct impact on the lives of others. That path led me to where I am now, here at Western Psych. In my time, I have worked on 3 different units and currently work in the Center for Autism and Developmental Disorders. On my lanyard, I have a collection of a dozen wristbands that patients have woven for me throughout the years as a show of appreciation and one of the many therapeutic activities we offer in the hospital. When I am feeling discouraged, the wristbands remind me that real change is possible with the right type of mental health treatment and support. Sadly, that kind of care is not accessible to too many in our community because UPMC has closed beds on almost every floor in the building. As an example, the Center for Autism and Developmental Disorders used to have 28 beds, with 1 unit serving children, 1 serving adolescents, and another serving adults. UPMC has completely shut down the units for kids and adolescents because they have understaffed our floor and we are down to only 11 beds. We can't admit a lot of the patients seeking care, so they have to wait months for backlogged outpatient appointments. For the patients we can admit, they are not always placed on the specific units that specialize in their particular diagnosis because of the closed beds. That can seriously undermine their treatment and our ability to provide UPMC's slogan of life-changing medicine. UPMC's underinvestment in our hospital has caused severe turnover. At present, there are 115 union nurses currently employed, and in the last 3 years, 123 nurses have left our hospital. UPMC does not value us and does not invest in the compensation that retains us. In the midst of a mental health crisis, UPMC has chosen to focus only on the most profitable medical service and has ignored smaller facilities like ours. The only way we have been able to protect what we have and advocate for our patients is through our union. We have a strong, united voice and a seat at the table. And today, we are using that voice to speak out for our patients. The population we treat at Western Psych is often misunderstood, stigmatized, and outcast. That's all the more reason each patient deserves our empathy and compassion. UPMC must do its part to solve the mental health crisis by supporting, retaining, and recruiting registered nurses so our patients have full access to the life-changing care they deserve. More scrubs! More scrubs! More scrubs! Thank you.
Awesome. Thank you for those moving words, Chris. Now I would like to welcome a leading mental health researcher and University of Pittsburgh professor, Dr. Nev Jones. Here you go. Is he coming? Is someone coming? Okay. Next, we have State Representative Dan Miller, who is a member of both the Autism and Intellectual Disabilities Caucus and the Mental Health Caucus.
Okay, I feel like we were just here. We were just here, right?
Yeah, we were.
We were just here and we were talking about this as a challenge and an opportunity. We were just here and we were talking about a way forward, not a way back. We were just here and we were talking about what will help people here and people trying to get in here, and that was our focus. But in order for us to stay in that focus, we need to have real contract offers to discuss. We need to have fair wages to discuss. We need to have real plans for what it is like to work those late shifts or those weekend shifts. We need to have real plans on the table to discuss. It's not right, it's not fair, it's not just to make everybody stand out in the cold because they're waiting for fair offers to come across that table. So look, here's the reality. Oh, you wanted to go ahead, brother. Thank you. It's cold, you got to work those applause in. So look, here's the reality for it. We said it before, we say it again. In here is a lot of need. In here is a lot of people who can help that need right now. And there are tons of people trying to get into facilities like this because they need the help. UPMC must take on its back the responsibility that it said it long had, which is to provide care into the mental health arena better and stronger, supposedly, than anybody else. It's hard to say that when you don't have your building full. It's hard to say that when you're turning over nurses at a rate of over 100%. It's hard to say that when you're squabbling over $1 or $1.50 an hour and say, hey man, I got to cut that. It is hard to say that. So look, here's what we need. We need that fair contract now, not tomorrow. We need it now. We need fair and righteous negotiations now. We need a real commitment to make a deal now. Nobody's looking for a labor issue, but if we have to bring it, well, then we'll bring it. But let's get it done. UPMC, we're waiting for that offer. Let's roll.
All right. Thank you, Representative Miller. Next, we have here Dr. Jeffrey Shook, a University of Pennsylvania professor of social work. Any luck? We're missing a few people today. They might show up. Is Allegheny County Executive Santa Inamorato here? Oh, instead? Okay. Emily Kincaid's coming. Okay. She's here? Okay. Should I come? Okay, sorry. Sorry for the confusion, ladies and gentlemen. We are having State Representative Emily Kincaid come up for us.
30-something brunette woman. I'm pinch hitting for the county executive. No, I am incredibly frustrated because we talk all the time at the state level about the mental health crisis that our state and our nation are facing right now among kids, among adults, and yet we have a building that is supposed to serve those individuals that is not full. We have too many people who are going unserved because UPMC sees no value in investing in the care for those patients. It is shameful that we would prioritize the most valuable services monetarily over valuable services for individuals. Healthcare is healthcare is healthcare, and when you need healthcare, you should have access to that healthcare. And it shouldn't be the bottom line of a major corporation that decides whether or not someone gets that healthcare. My dad is an anesthesiologist, and until he retired, he was working out in Williamsport. UPMC purchased the hospital system that he was working for, so now it's UPMC Susquehanna. So the idea that UPMC wouldn't have the money to be able to pay these nurses fair living wages to provide the necessary care in a crisis situation is shameful. It is a lie. If you can spend millions and billions of dollars in the acquisition of other health systems, you can open this building fully and give the people of Pennsylvania the treatment that they deserve. You can give these nurses who care about their patients the payment and the benefits that they deserve, that they have earned. We deserve a healthcare system in this city, in this Commonwealth, that prioritizes patients, all patients, not just the most monetarily valuable patients, all patients equally. Healthcare is healthcare. Open this building, pay these people, UPMC.
Thank you very much, Representative Kincaid. Okay, now we will have one of our leading mental health researchers and University of Pittsburgh professor, Dr. Nev Jones.
Okay, so we are all gathered here out of concern about the state of mental health services, prominently here at UPMC, including acute inpatient services for residents of our county experiencing mental health challenges and crises of various kinds. I am speaking here as an associate professor at Pitt, a mental health services researcher overseeing over $10 million in NIMH funding focused on public mental health services research. But perhaps most importantly, I am here as an individual with a diagnosis of schizophrenia who across their life has made extensive use of inpatient services. Western Psych is by far the largest psychiatric hospital in the county, processing the lion's share of psychiatric crisis holds, colloquially known as 302s, and situated to play an outsized role in shaping local pathways to and through care. To emphasize that, a major role shaping the experiences that clients or patients have across the county as they cycle through the inpatient system. The impact of their experiences here at Western ripples out across outpatient services and adjunct social services. As invested citizens of the county and leadership in the mental health space, it is ethically incumbent on us to ensure adequate support and compensation for the backbone of the inpatient psychiatric workforce, namely psychiatric nurses. The current state of affairs at Western, at UPMC, and frankly within the county more broadly, reflect systemic disinvestment in both youth and adults with serious mental health challenges. Disinvestment that lays bare the concerning financial motivations of high-level executives who, from the comfort of multi-million-dollar homes, shelter themselves from the realities of the institutions they strip of adequate resources, farther still from the inevitable impacts on the frontline workforce, and most alarmingly, vanishingly far from the lives of those disproportionately experiencing high rates of homelessness and poverty who rely on the safety net crisis services that Western provides. Individuals with such significant mental health challenges are in general in American society among the most politically disenfranchised. Elected officials are quick to blame mental illness for homelessness, quick to blame mental illness for gun violence, and so on. A very politically disenfranchised community has little political capital to push back. In disinvesting in Western Psych nurses, and by extension patients, executive leaders are likewise banking on and indeed profiting from perceived fear and powerlessness. As today's strike signifies, and the leadership of SEIU and the Pittsburgh labor community, among others, we are here to prove those executives wrong, joining forces to signal that the citizens, including Pitt faculty, mental health service users, nurses, social workers, and other providers of Allegheny County will not tolerate profit over people, will not tolerate executives who prioritize the clinics and services that they can extract the most profit from while breaking the clinics and services that, instead of generating profit, function as a lifeline for some of the most vulnerable youth, families, and adults in the county. We will speak truth to power, demand accountability, and not rest until change is real, calling on all those who directly participate in and de facto enable the status quo to continue to reflect on the words of Reverend King, "Never, never be afraid to do what's right. Society's punishments are small compared to the wounds we inflict on our souls when we look the other way." Thank you.
Thank you, Dr. Jones. All right, next up we have Dr. Jeffrey Shook, who is a University of Pennsylvania professor of social work.
Good afternoon, everybody. My name is Jeffrey Shook, as was just announced, and it's so incredibly humbling to be here again today with all of you. I'm a professor of social work at the University of Pittsburgh, and I'm also co-principal investigator of what's called the Pittsburgh Wage Study, which has been operating here for 8 years. Through the wage study, I've had the real privilege of surveying, interviewing, being in meetings with, presenting with, writing op-eds with, and most importantly, listening to thousands of hospital and healthcare workers, care providers in this city. One of the biggest takeaways from this study is that you make Pittsburgh a great city. Hospital workers, healthcare workers, care workers are truly the backbone of Pittsburgh. We depend on them, and we owe them a lot. That is why, despite the fact that I am so very humbled to be here with you today, I am also quite frustrated. Through your advocacy, your organizing, your efforts at the bargaining table, you've used your voice to call out what low staffing and pay not only means to you, but means to your patients and the care that you're able to provide. You are the backbone of this city, not only for the work you do, but for the commitment you bring to the work, commitment that is communicated daily through your efforts to provide the best care possible. The reason I am frustrated being here today is that despite your work to raise these important issues, understaffing, burnout, turnover, unsafe conditions for you and your patients, the physical and mental toll of the work, low pay, we are back here calling out these very same issues that have been raised for not only the last few months, but for many years. Since it began, the Pittsburgh Wage Study has documented these issues. We have found that low pay has led to hospital workers experiencing significant financial hardships. Understaffing places extreme demands on healthcare workers, requiring them to take on unsafe workloads and perform vital tasks outside their training and jobs. Financial and workload stress has mounted, leading to high levels of depression, anxiety, suicidal ideation, trauma, and burnout. The work you do can be unsafe, with many hospital workers reporting verbal and physical harassment. Care providers want to stay in their jobs, are committed to the work, but many leave because the situation has become untenable. But we did not need research to know these things. For years, hospital workers and care providers have been raising these issues and organizing to push for changes to fix them. Through my many conversations and through our data, it is clear that hospital workers have solutions to fix these issues if leaders just listened. So I am proud to be here with you today. My admiration for your work and commitment and frustration that your leaders are not listening will bring me back again and again. It is time that UPMC and our healthcare system more broadly listens to its workers and fully commits to the well-being of you and your patients. Thank you.
Thank you, Dr. Shook. All right. Last and certainly not least, we're honored to welcome Allegheny County Executive Sarah Inamorado.
Hello. Here we are again in front of a UPM facility telling them to do the right thing and invest in their workforce. Yeah. Because we feel this as a community when a third of these beds are shut down and can no longer care for patients who have mental health and behavioral health needs. The people behind me, they're doing incredible work, and it often goes unthanked and unacknowledged by the community and definitely by their employer. And I'm here to say thank you. Thank you for the work that you do. Thank you for the care and the treatment that you provide the people who come through those doors. You don't vet the folks who come in there. You see people at their worst. And you deserve to be thanked. You deserve to be safe. And you sure as hell deserve to be paid. And I want to say to folks who maybe haven't ever had a loved one come through these doors, I know I have. I know I've had friends who have ended up here. But the folks who haven't, who don't have any interactions with our mental and behavioral health system here in the county, I will say when folks like UPMC don't step up and care for their workforce, and we have beds that are going unfilled, and we are starving a desperately needed system of valuable resources, when they're not paying their fair share into that system, the burden falls on all of us. We are responsible at the county for running our mental health and behavioral health systems. So if UPMC isn't stepping up and paying their fair share, it falls on all of us, the taxpayers, to support a system that can care for the least among us. And when we have people who are churning through these doors and there's not enough beds for them to stay in, they're not receiving the care that they need because people are burnt out and they're over capacity, you know where they end up? They end up on our streets. They end up in our homeless shelters. They end up in our county jail. And we see this time and time again. And we say no more. We're saying, UPMC, do the right thing. Do the right thing, invest in your people, put up your fair share to help address extreme mental health issues that people are facing, people who are struggling with addiction. Help us. Help us. Don't let the public bear the burden of your inaction, because we will no longer stand for it. And I support the nurses standing here today, tomorrow, and the next day until you step up and do the right thing. Thank you.
Thank you very much, Executive Inamorado. And Dr. Ken Thompson was actually able to make it today, so we will have him up next. A leading psychiatrist both locally and nationally.
Good afternoon, everybody. I've just walked up the hill, so I'm going to maybe be a little breathless, but it isn't purely the hill that's making me breathless. It's my irritation with having to come back here after we were just here 2 weeks ago and made it very clear that it was time to support the nurses. It was time to pay the nurses. It was time to recognize how critical their work was to the mental health of the people of Allegheny County. So I'm back, and all I want to say about it is this. I took the 61C from downtown, the bus, and I sat up in the front because I'm an old guy now and I get to. And the group of us who were sitting up front, they started to ask me, like, you've got clothes on that look like you're kind of important maybe. Where are you going? And I said, well, I'm not important, but where I'm going is important. I'm going to talk about the strike that the nurses are having to say they're going to do if there isn't negotiation. And they all said to me, every one of those people in the front of the bus said, those nurses, they got to work so hard. They have to deal with so many challenges. We've got so much mental health problems out here in the streets, in the communities of our city. We are 100% behind you when you go up and talk to them and tell them from the front of the bus, from the front of 61C, that we want to see a settlement. We want to see the folks who are running UPMC, who live and fly around in fancy limousines and rented leased airplanes, jets, who have fortunes in their pockets because of what they're being paid. We want to see UPMC start to lead in the United States and in Allegheny County. And it's time, it's past time. Thank you very much.
Thank you very much, Dr. Thompson. And thank you to all of our speakers. Ooh, sorry, the wind. Thank you to all of our speakers for your powerful and moving support. In closing, I want to say that as nurses, we never want to strike. We hope that this picket is as far as we have to go. But we have voted unanimously to authorize a strike because we have to stand up for our patients, and UPMC is leaving us with no other choice. If we can help our kids, our adolescents, and our adult patients to get the right treatment, resources, and tools, we can stop the cycle of going in and out of our hospital and offer them much more success in life. So let's keep advocating for our patients together. To support us, please go to supportwesternpsychnurses.org or post your social media using the hashtag hashtag support Western Psych Nurses, and tag UPMC. Let them know that we care. Let them know that you care, that we are fighting together as a community. Thank you, everyone.
Please stop! No